Restore, the holistic healing Pilates studio here in Cape Town. So today I'm going to talk about a tummy gap. So that's a separation of the midline, and I'm going to show you a quick video on how to diagnose and recognise if you have this. Just to explain it, the separation of the midline, the tummy gap, occurs when you're pregnant and you've got the expanding tummy to accommodate your growing baby. And the midline is made of connective tissue, which does expand and starts to separate. However, if that gap doesn't close again, it can leave you with things like a very weak core leading to lower back pain, and also that mummy tummy that you just can't seem to shift, despite the diets, despite the trips to the gym, and you're just going to probably be becoming very, very frustrated. But first, let's try and look at how we're going to just recognise and diagnose if you have that tummy gap, which medically is called a Diastasis Recti. You need to be on the floor, so I'm going to go through this with you step by step. I want you to lay down, go onto your backs, bend your knees, and I want your knees and your feet hip distance apart. I don't want you pressing your lower back into the floor and curling your tailbone under. I want you to lengthen your spine so you've got a small natural curve here of the lumbar, and I want you to just lay nicely in this position. Now, think about the rectus abdominis, that's the long muscle here, goes from the diaphragm, the sternum, all the way down to your pubic bone. That's where we're trying to look. You're going to take two fingers and you're going to just hold them across your midline here. And you're going to gently rub. Now, we're going to measure in 4 places. At the top here, just beneath the sternum, at the top of the ribs. A little bit further down, then on your belly button, and then at the bottom here. Just above your C-section scar if you had a C-section. Place your fingers across the top here, across the midline. Simply lift your head and shoulders just off the floor, soften your neck, and you're going to be pressing. I want you to press and rub, and you're going to be looking for the 2 borders of your abdominal muscle and feeling if there's a gap in between and lower. Come down a little bit further, you're just above the belly button now. Do the same thing, just curl your head up, press down with your fingers. You're looking for if there's a gap between the 2 borders of the abdominal muscle, and come down. Most postnatal mums will notice it greatest at the umbilical, here, your belly button. Same thing, you're going to hold your fingers across the belly button, you're going to gently lift your head up off the floor and your shoulders and press. And you're going to continue doing that at the bottom as well. If you find you've got a gap between the 2 borders, and you can push your fingers in, if it's 1, 2, 3, it can be greater, and you push down and you're feeling it very, very soft inside, this could mean that you do have a tummy gap, you do have Diastasis Recti. But don't panic. I don't want you to panic. I don't want you to get freaked out by this, because there is a solution and we can help you. We can close that tummy gap through a program of holistic healing, the right type of movement and the right type of exercise to help you restore your core and get you back into shape again. So please go onto my website, sign up for my newsletters, look out for my blogs, learn with me on how we can help you, how we can heal you, and how we can close that tummy gap and get you back on form again. Thanks for watching my video, and hopefully I'll see you in my inbox.